Cat kidneys are weak, and only the right diet will actually keep them alive. This might be something your veterinarian has actually told you in the past. But is there really any truth to this? Do cats really pass on all the time due to renal or kidney disease? Well, did you know that kidney disease affects 1 in 3 cats over the age of 10 years old? It's probably one of the most common and probably one of the most serious health issues our feline friends can face. So if you're a cat owner, understanding kidney disease and how it happens, how it can be detected early, and what to do is really important. Check out this video. Hello everyone, and welcome to Zoomies. So today we'll be discussing what renal disease is, what are the signs to watch out for, and how your vet will actually diagnose and treat it. And maybe I'll add in some tips to help you manage your cat's health. So let's get started. Let's maybe talk about what exactly kidney disease entails. Well, for starters, the kidneys. Kidney or renal disease in cats occurs when these organs can no longer effectively remove waste products or toxins from the bloodstream. They also have quite difficulty maintaining the balance of fluids and electrolytes in the body, but they can be roughly divided into 2 types: acute kidney injury and chronic kidney damage. As the name implies, acute kidney damage is sudden and often due to toxins, certain infections like ascending bladder infections, or even blockages, which is most commonly due to a thing called urolithiasis, or actual crystals that clump together to form stones in the urinary tract that can actually block the flow of urine. Where chronic kidney disease, also referred to as CKD, is more of a gradual decline in kidney functioning over time, usually due to age or other underlying conditions, which would make more sense that CKD is kind of more common in older cats. So now that you know the difference, what about you actually see that will get you thinking that your cat might be in danger? Well, the most common sign, I would say, is actually increased thirst and urination. These are some of the earliest signs that you can see in kidney issues. So if you do notice your cat kind of drinking a bit more water than usual or making more frequent trips to the litter box, it's time to take note. But you should know that cats don't just drink water from their bowls, but they love to drink from outside water sources, flowing water, or even from the basin. But it is important to note that there are actually other issues that can also cause increased thirst, like diabetes. I'll link a video in the description about diabetes in pets if you want to go watch it. Another common sign is actually weight loss and decreased appetite. Not always seen together, but as kidney disease progresses, your cat may start losing interest in their food and begin to lose weight. This also occurs naturally in older and healthy cats as well, but would probably be a bit more rapid in renal disease. Sometimes you might even see an unkept coat. Severe lethargy and weakness. Failing kidneys can actually make your cat feel really tired and weak from all these toxins and waste materials that are building up in their system. And all of this can actually lead to more obvious signs like repeated vomiting and possibly even diarrhea, despite not really changing anything in their diets. Then a kind of less but more severe one is bad breath and even mouth ulcers. These toxins that we spoke about earlier can actually cause a distinctive ammonia or acetone-like smell to your cat's breath, and you may actually start seeing ulcers forming in their mouths or on their tongue. If you see any of these signs, it's really time to book an appointment ASAP at your local vet. But at this point, this is when people start to ask, but what will the vet actually do? Well, for starters, a good vet will begin with a good physical examination and history taking. They should ask a bunch of questions while your cat gets examined nose to bum. They might be looking for signs like dehydration, weight loss, and any dietary standards of your cat. Next, they might follow this up by running some blood or urine tests. These are actually key to diagnosing kidney disease in cats. Blood tests will check for elevated waste products like creatinine and BUN, or blood urea nitrogen, while urine will measure the actual concentration of urine, which kind of roughly indicates how well the kidneys are doing their job. Vets use an international system called the IRIS staging method to determine the stage of renal failure in your cat. Stage 1 being less severe and stage 4 being possibly lethal. A more advanced set of tests is actually imaging like ultrasound or x-rays, which might be considered to assess the kidney's size, shape, and condition. But it can also be used to check for other issues or other abnormalities such as blockages. So at this point, if your cat is diagnosed with renal failure, there are actually some treatment and management options that could make a massive difference in your cat's prognosis and even life expectancy. I would say dietary changes is probably the biggest factor, A special low protein diet, low phosphorus and sodium, can also help to reduce the workload of the cat's actual kidneys. These diets include the prescription diets like Hill's KD and the Royal Canin renal diets. These have actually been scientifically proven to counteract the effect of kidney damage and increase the quality of life of your cat. I personally advise for people to avoid meat-based diets, whether they're cooked or raw, as these tend to be way too high in protein and in certain minerals, but it would maybe be a really good idea to consult a qualified nutritionist if you are still considering them. The second most important factor is water intake or fluid supplementation. Subcutaneous or even intravenous fluids can help keep your cat hydrated and flush out any of those toxins in especially severe or acute cases. This is often a key part of managing CKD, and it is a well-known fact that cats do not take in enough water. So hydrating their food is a really good way to help them get enough water intake, whether it's bone broth or just adding water to their kibble. Lastly is using medications. Your vet may actually prescribe certain medications to help control symptoms like high blood pressure, nausea, acid reflux or acid buildup. And then tools like pill poppers can also be really useful to administer these medications, especially when your cat starts feeling a bit better or is known to become a little spicy. A key aspect of this entire situation is monitoring and regular checkups, which will almost likely include blood work. They are crucial to track the progression of the disease and to adjust treatments as needed in future. Now we can talk about some tips for you that you can use to check for potential danger in your cat. Number one is stay vigilant. Keep an eye out for any changes in your cat's behavior or health, especially as they grow older. If you aren't sure, rather ask than assume that everything is well. Number two is follow your vet's advice. Adhering to your vet's recommendations for dietary changes, medications, and fluid therapy can really make a big difference in your cat's quality of life. And then lastly, and sometimes in severe cases, provide comfort. Make sure your cat has a comfortable, quiet place to rest and plenty of water available at all times. And this is especially crucial if they get older or have other conditions like arthritis, which can make moving around a bit more difficult. I advise making these types of cats kind of indoor-only cats, as it just makes it easier to control the disease this way. Kidney disease is a serious issue for all of our feline friends, but with early detection and proper management, many cats can still enjoy a good quality of life in abundance. I wonder if natural remedies are any good. Maybe we should do a future video on that. Thanks for watching. And I hope you really enjoyed this video and it helped you to understand more about kidney disease in cats. If you want to find out more tips that you can implement and ensure that your pet is happy and healthy, subscribe to this channel. And until next time, cheers.